Uh, hey everyone, hope the week's going well for you guys. Now, this week's discussion is focusing on the significance of systematic reviews in exercise science and how they contribute to evidence based practice. Now, after learning more about evidence based practice over the past week and a half, I think that systematic reviews are one of the more valuable tools, I should say, that researchers and exercise professionals can use when trying to make informed decisions. To begin, a systematic review is a type of research study that collects, evaluates, and synthesizes evidence from multiple individual studies focused on a specific research question. Now, unlike a traditional literature review, which may summarize research more generally or selectively, a systematic review follows a highly structured and standardized process for searching, selecting, and evaluating studies. Researchers conducting systematic reviews use predetermined inclusion and exclusion criteria. They search multiple scientific databases, assess study quality, and attempt to minimize bias throughout the process. Now, in many cases, systematic reviews may also include a meta-analysis, which uses statistical methods to combine data from multiple studies in order to determine overall trends or effects. Now, I think one of the biggest differences between systematic reviews and other literature reviews, especially in exercise science, is the level of objectivity and methodological rigor involved. Now, traditional literature reviews can sometimes reflect the author's perspective or selectively focus on studies that support a certain conclusion. But systematic reviews, however, are designed to reduce bias and provide a more comprehensive overview of the available evidence. In exercise science specifically, systematic reviews are extremely valuable because research findings can sometimes be inconsistent. One study may suggest that a certain training method is effective, while another study may find minimal benefits. By analyzing multiple studies together, systematic reviews help researchers and professionals identify broader patterns and determine which interventions are most consistently supported by evidence. I also think systematic reviews are important because exercise science is such a rapidly evolving field. New research is constantly being published regarding strength training, rehabilitation, recovery strategies, nutrition, cardiovascular health, and athletic performance overall. And it would be very difficult for professionals to individually analyze every new study that's coming out. Systematic reviews help organize and summarize all this evidence so that exercise professionals can make more informed decisions without relying on isolated findings or just fitness trends from social media. Now, as a personal trainer, I think it is especially important because clients are constantly exposed to new information online through stuff like social media, podcasts, influencers, and marketing campaigns. And many exercise trends become popular before there's any strong scientific evidence supporting them. And systematic reviews can help professionals determine whether certain interventions are actually effective or whether the claims are being exaggerated. For example, one area where systematic reviews have had a major impact is resistance training and chronic disease management. Multiple systematic reviews have shown that structured resistance and aerobic exercise programs can improve cardiovascular health, muscle strength, functional capacity, and just overall quality in life in both healthy and clinical populations. And these findings have influenced exercise prescription guidelines and rehabilitation protocols in settings such as cardiac rehab and physical therapy. Since my final project focuses on exercise rehabilitation following stroke and cardiac events, I've become particularly interested in how systematic reviews influence cardiac rehabilitation practices. Now, research synthesized through systematic reviews has helped me establish exercise as a core component of recovery following heart attacks and strokes. These reviews provide evidence regarding appropriate exercise intensity, frequency, and progression, while also helping clinicians identify which interventions are safest and most effective for specific populations. Systematic reviews have also influenced decision-making regarding chronic lower back pain management, which is another area I encounter frequently as a trainer. In recent years, systematic reviews examining interventions such as Pilates, yoga, mobility training, and resistance exercise have helped shift treatment approaches away from prolonged rest and towards more active rehabilitation strategies. And this has changed how many professionals approach chronic pain management and corrective exercise programming despite their benefits. Corrective exercise programming. Despite their benefits, there are also challenges involved in conducting high-quality systematic reviews in exercise science. One challenge is the variability between studies. Exercise interventions can differ significantly in training intensity, duration, frequency, participation demographics, and even outcome measurements. Because of this, it can sometimes be difficult to directly compare studies or combine findings in a single conclusion. Another challenge is going to be study quality. Systematic reviews are only as strong as the studies included within them. If many available studies have small sample sizes, poor methodology, or inconsistent protocols, then the overall conclusions of the review may still be limited. Researchers also have to be careful about the publication bias because studies showing positive results are often more likely to be published than studies with negative or insignificant findings. I also think that there are practical challenges related to interpreting systematic reviews in the real-world settings. While systematic reviews provide you valuable evidence, exercise professionals still need to individualize programs based on a specific client's needs, goals, injury history, and physical limitations. Research findings may not always perfectly match real-life situations, which is why professional judgment remains an important component of evidence-based practice. One area within exercise science that I believe still lacks enough comprehensive systematic reviews is long-term impact of wearable fitness technology and even AI on exercise adherence and rehabilitation outcomes. Wearable devices such as heart rate monitors, smartwatches, and recovery trackers are becoming increasingly common in both fitness and clinical settings. However, I think more systematic reviews are needed to determine how effective these technologies actually are in improving long-term health outcomes, recovery compliance, and overall behavior change. I also think there's room for more systematic reviews examining individualized rehabilitation strategies for cardiac and stroke patients. Since recovery outcomes can vary significantly between individuals, more evidence could help professionals create safer and more personalized exercise interventions for clinical populations. Now, overall, I believe systematic reviews play a critical role in advancing evidence-based practice within exercise science. They help organize large amounts of research, reduce bias, identify effective interventions, and improve professional decision-making as someone working in personal training and interested in cardiac rehab. I think understanding systematic reviews is important because it allows professionals to apply research-supported methods rather than relying solely on trends and anecdotal information. Ultimately, systematic reviews help bridge the gap between research and practice, which is essential for improving client outcomes, rehabilitation strategies, and long-term health performance. That's all I got. Thank you. Look forward to hearing everyone else's thoughts on this interesting topic of the week.